till they are broken. Well, I'm going to say just in advance, if you could bear with us a little bit for any glitches that we do have as we go along, because both Joe and myself have been dealing with a household struck by COVID over this last couple of weeks, and my first day back was yesterday. I think Joe's possibly not even back at work yet officially, so yes, please bear with us. So Amanda, did you want to introduce yourself?
Yes, I'm mainly going to be here in the background. You won't hear much from me. My name's Amanda Elliot. I'm the strategic health lead with Contact. I also happen to be the parent carer of a young man who's autistic and has quite challenging mental health needs as well. Thank you.
And I'm Jo Gilliland. I'm here as the National Network of Parent Carer Forums representative for the North Eastern Cumbria, and I'm also a mum to a wonderful young man who has autism.
And so that leaves me. So I'm Ellie, and I work for Contact as the business development manager. I was in charge of putting together the pilot for the Young People's Admission Avoidance project. I'm also a qualified teacher with 20 years of specialism in provision of SEND, alternative provision of SEND. And I also am a mental health ambassador, tutor for schools. And also a mum of a now 14-year-old boy who, at the point of putting this project together, was in his 6th month of an 8-month admission in a Tier 4 unit, which was 2.5 hours away from my home. So, as you can imagine, with the opportunity of such a project, didn't just speak to me, but it actually shouted at me. So, yes, I hope you enjoy some of the learning from today.
So we thought it might be helpful just to do a really brief introduction to Contact, which used to be known as Contact for Families of Contact to Family. For those of you who perhaps aren't parents of disabled children, we're well known in the community, but we provide advice, information and support to families 0 to 25, regardless of diagnosis or not. There on is a list of the huge range of conditions that our families have. We've got great reach and great involvement. Even myself, with my son's 23, I used Contact 1 trillion times for various things, and they're absolute lifeline. One of the key aspects of our work, as well as providing support to the National Network of Parent Care Forums, is our ethos of bringing families together to help each other. So the whole co-production and peer support thing is really key to what we do as well. That's it for me. Yes, so we wanted to just really recap on the context of the policy context of this project. Many of you may be already aware of this, but within the NHS long-term plan, there were some specific commitments to autistic and learning disabled children and young people, and I've just pulled out the main ones. One is working together, health and partners working together to develop support packages for children who are autistic or have other neurodevelopmental disorders throughout the diagnostic process, i.e. before, middle and end as well, and after. Also the commitment towards reducing the number of children in Tier 4 beds, basically, by 23-24. And then obviously the additional investment in crisis and forensic and community support to avoid the need for admission. So just doing a quick recap of the policy context, the drivers behind why the NHS in particular, but others really, really want to try and crack this problem. Thank you.
Okay, so we thought we'd start off by asking you a bit of a question, a bit of an interactive one, trying to bring in a little bit of jolliness to the late afternoon. And I know I'm thinking, oh, what time is it now? So if you have used Mentimeter before, what I have just noticed is that there is no code on here because it's not my presentation. Right, I think what we're going to have to do is, because we seem to have a technical glitch, we'll either go to hands up or pop in the chat. So what you find is the biggest barrier to creating the right support that keeps children and young people in crisis out of hospital. So I don't know if we've got any brave volunteers who'd like to go first, if they've got anything. Overwhelmed the room. There we go. Yeah, lack of whole systems approach. Anybody else? Okay, well, we'll just move on. Right. So basically about the project, we'll give you a very brief overview. So the project was put in place as part of the goals of the long-term plan and through the transforming care models that were aimed to prevent crisis and hospital admission of young children with learning disabilities and or autism being admitted into Tier 4 beds. We in the North East wanted to concentrate on an early intervention offer for families. Now this went live, the idea of it went live just before we went into a pandemic, so we were in a very rapidly changing landscape when we issued this piece of work. And it was focused on families in the North East and North Cumbria ICS, which covers 13 local authority areas. And the offer was put together to include some one-to-one support, some workshops, listening ear appointments from Contact, and peer support alongside some expert-led webinars. So we started the phase 1 pilot, as I've just mentioned, in the January to the March 21, and then obviously we're plunged into lockdown, and we saw therefore established phase 2, which lasted from April to July, but with an expanded offer, which I believe Ellie will be talking about a bit later on. Phase 2 of this was funded by local transformation money and the North Cumbria and North East Child Health and Wellbeing Network. And we managed to reach a total of 200 parent carers. Over to Ellie.
Thank you. So our key findings completely, but not by surprise whatsoever, is that families in crisis are really struggling to access support. Often that's because they are so overwhelmed with their own circumstances in the home environment, as well as trying to keep on top of the many appointments with various different sort of departments and clinicians, etc. It's just so much, and they are, as I'm sure Amanda will say, incredibly resilient people, but they're already on their knees and unable often to commit, especially for regular sessions, and also we found that to be able to engage in kind of more of a group environment was really tricky for them too, because often just showing up as an individual with that sort of peer support was difficult. So they needed more support also in the home to support their children, especially around sensory processing, and also at school. And there was a lack of access to that. And that also what they really needed was sort of a mentor, somebody who could really hold their hand when they're feeling like they've just got nothing else to give. And that they needed more information that was around the aspects of support that they were unaware of, that they couldn't have the sort of resources available to them to be able to meet their needs and support them adequately for at home. Okay, next slide. Joe, I think this one's you. Yeah,
I'll go back. So the need was identified across the 13 local authority areas in the North East and North Cumbria ICS. We have historically had a higher number of young people in Tier 4 beds than the national average. We wanted to reduce this, and we want to keep young people at home in their communities where we possibly can. And we have incredibly long, and I say have because unfortunately it has been impacted by the pandemic. We still have incredibly long waits for autism assessments and pathways. COVID just put everything under a microscope. Families were losing services, not gaining them. And we found that families were heading towards crisis much more quickly than they previously had been. And we needed to do something to support them during this time. We already luckily had some really good networks in North Cumbria and the North East, such as the Children and Young People's Peer Network, which brings together family carers and professionals from across education, health and care. And we thought, well, how can we leverage this position with this network to get the message out to as many families as possible? So part of the offer, on top of what we've already talked about, we also had newsletters that had hints and tips and mindfulness sessions. We had the programme running alongside. And parent carer forums wanted to see how we could use our networks and the voluntary networks to spread the message and support as many families as we possibly could during this time. So I'll move on to the next slide. Am I back to you, Ellie? No? I'll keep going then. So we in phase 1, we looked to specifically identify those children and young people who were already on the dynamic support registers, and we targeted them through the DCO and DMO route. We asked them to put forward some families and young people who they thought would be really good candidates for this intervention, to see if we could do anything to sort of mitigate the risk of them entering a Tier 4 bed. So all of these young people were on the diagnostic pathway, either awaiting assessment or having been assessed, and they would have been eligible for a CETR. And we got those referrals in via those DCOs and DMOs. So it was meeting those families with the highest need at that particular time. Okay. I was waiting for it to, I did press the button. There we go.
Okay, so in this phase 1, it was over a 3-month period, which was quite a challenge to be able to go from going live in the January and completing by the end of March, obviously to sort of spread the word, get the clinicians on board, etc., to be able to make the referrals. But the way that it worked, it took a little while to get going, but once people had understood that, what the possibilities were and how the referrals were working, we were able to offer a listening ear appointment, which was sort of the kind of the entry point for each of the families, and that would be with one of our family support listening ear consultants, and they were able to sort of do like an initial assessment at that point of what the family's needs were. And knowing what we had on offer in terms of the music therapy, the play therapy, the one-to-one support, etc., it meant that we were able to offer them what was going to be meeting their needs the most. So often that would be sort of just 1 or 2 appointments with a listening ear consultant whilst they were able to advise on what the best sort of next steps were, or work out what sort of support they would need. But sometimes that might be 3, 4 or 5 appointments, which meant that they were able to be continually supported through their journey. So from that listening ear appointment and consultant, I think that was really sort of that kind of key worker role like we've been talking about earlier, but really, really personally centred. And they then would signpost them, as I said, to the different sessions. They would also consider what their needs were and take on board the information from the families around what was missing, even though they were engaging with the other aspects of our provision. That then helped us as we went on to the next phase to be able to sort of flex and change our delivery a bit as well. Next slide. Also didn't mention as well in part of the phase 1 was that we also did a webinar on the dynamic support registers and CETRs as well, which was sort of information and guidance for the families. So not only was there information and guidance within the webinar, for example, but also as part of Contact's core offer, then we were always able to use what we have free to all families to be able to continue to support and signpost the families involved in this project. So as you can see there with the outcomes, I mean that first quote I think really speaks for us and the success of the project, that if it wasn't for Contact and this pilot, that this young man would in fact be in an ATU by now. Very challenging circumstances that families are finding themselves in. Often I know that Shona, who is the listening ear consultant who is in charge of the majority of the listening ear appointments and managing those that are engaging in terms of the consultants, that we had families who were so distressed, often with violence and things going on in the home. There were situations that they just could not manage, and were really needing to have access to those. I mean, often it was even text messages, or you know, sometimes face-to-face calls if they were needed, and sometimes over the telephone, but also being able to do, as you can see in the bottom quote there, actually help them to support with IT equipment, getting the laptop so that they could actually go online and make use of the support that we had on offer, but that also helped during lockdown for access to education as well, and some form of normality and continuity for these young people. Next slide. So then as we went into phase 2, so it was quite difficult going into, we sort of almost had to close down the project and then relaunch the project when we were able to have further funding, but which obviously we were very pleased to have. But that meant that we were able to take our learning from that phase 1 and be able to have that flexible approach, because of the fact that we're very blessed with the family support consultants that we have and all of their expertise, as well as continuing with those listening ear appointments and support not only the families that we had already supported, but continue to support more families. So you can see there the listening ear initial appointments. So that's 45 new appointments and new families that we were working with, and then going on with subsequent appointments. So that was sort of the, you know, ongoing sort of mentoring approach throughout the whole of the pilot. We continued with the one-to-one peer support sessions because they had proved to be invaluable. And we also added in sensory workshops, which actually were very oversubscribed. And we had speech and language workshops, which were then followed on by Makaton workshops. And these were all sort of recognised by the families as areas of support need that they had. The workshops which we put on, again through our contact workshops, were chosen for suitability against the families that were engaging with the project. So there we had, for example, the money matters, where I know that often the stresses within the families around money and finances have such a huge impact on the stress levels, which obviously has an impact on what's going on for their relationship with their child as well. The family support consultant that we have, who is on the listening ear, is also oh, we've lost our slides, a specialist in positive behaviour support, and sort of expert also in sleep. So that's been incredibly important. I'm really lost without my slide. Wait. Oh no.
Sorry, Ellie. I'm having connection problems. You know how I said earlier, I usually can't run more than one thing. Can you see them again?
No, can't see them at the moment, but it's okay. I can carry on. I can speak the quotes whilst you get us back online.
I'll try.
So on the next slide, we're talking about some of the quotes. So we have wonderful having Shona to talk to offload our challenges, someone who's been there and has real strategies that help. That's something else that was really important to this project, is that our family support consultants are often, I think actually virtually all of them are family, you know, they're carers themselves. And so they really do understand what the families are going through. And can offer that sort of, you know, experience to bring to the table as well. The music therapy, we were really surprised, or I certainly was really surprised to see how successful music therapy could be done virtually. But we had a young lady who had never engaged in any activity ever, as well as they had with the music therapy, and also had help with council tax reductions, and we're awaiting a DLA response, all of which was a supported journey with our listening ear consultant, who gave help and guidance to be able to be in receipt of those. Throughout all of the workshops, we have feedback of, you know, excellent tips and guidance. It's always really important that the workshops contain sort of real, meaningful top tips and you know, things that people can actually put into practice once they've attended one of our workshops. Shall I just keep talking? That's fine. I'll keep talking. You know, I'll keep talking. So,
I've had problems with Teams, and it's just it's not playing ball, unfortunately.
I'm just seeing if I can share the PowerPoint slides. Just bear with me. But keep talking, I think.
Okay, well, I might have got to the end by the time you do that bit. So in terms of the successes, so we had some really great feedback from families around sort of improved well-being and confidence. We have, through the sensory processing workshops, they were so oversubscribed that we actually had waiting lists of sort of between 70 and 100 places on the waiting list. So there was clear evidence, and we have actually used some of the underspend that we have from this project to continue with sensory support over the last couple of months as well. The alternative approaches available that we were able to offer at a time of risk and crisis. The other successes included, oh, we're there, excellent. The fact, I'd say, that we were flexible and we understood
got some weird stuff to the right, but I'll try and enlarge it.
That's okay. What's working well for their families, and being able to have that sort of a flexible approach. We had the improved community-based support and reduction in reliance on the specialist hospitals. So that then had a reduction in inappropriate out-of-area placements, which we know in itself, average cost of admission is £40,000. Now that our project, over the 6-month period that it was running, our sessions was an actual spend of 65,000. So if you actually look at that financially on social return on investment, then if we just saved 2 family admissions, then actually we were, everyone's quids in, as they would say. So we know that it was successful on that basis. And it's also really helped us to understand what's needed more for those families, and have the evidence that we need to be able to then provide that. And yeah, that last one, the reduction in admission as a direct result of our pilot, well, that's why we did it. So that case study there, I don't think anybody wants to listen to, certainly not me, read that through. I'm going to put that there for a minute so that people can have a chance to read a case study. We do have others which are very powerful, but don't have full permissions at this stage to be able to share those. This one we do. Maybe you could use this time as well to pop any thoughts that you have in the chat, and maybe any questions that you have that we can sort of open up for a bit of discussion there as well. I can talk to this slide, but I thought I'd give it a break whilst people might want to pop things into the chat. So future plans for the project. We have some further funding to continue this support, which we are expecting at the moment to be for at least 1 year, hopefully, obviously more. And that will be for the North Cumbria and North East area where we have been working. Our aims for the future of this project and projects similar to this, bearing in mind that it's been a bespoke approach that's been relevant to the regions that we've been working with, is that we can have a similar bespoke approach to other areas across the country. So if you think that this type of approach might be useful in your area, then please do get in touch. We have so much to offer and such a range of expertise that we're able to engage with, that we feel that we can put something really positive together for your families, and we have done that, and we know that we can do that. Also, the other area is obviously in terms of the monitoring and evaluation, which we've been able to do, and really looking at that cost benefit analysis. We've started doing some work on that based upon the outcomes from the pilot, but obviously with another year ahead of us at least, we'll be able to gather so much more evidence to be able to put to that.
Does anybody have any questions or want to discuss anything in their area or ideas? You don't just have to post in the chat if you want to ask anything.
I can see a hand up, I think, but I'm not sure. There we go. Lisa.
Hi, I'm Lisa White. I'm a clinical case manager from Surrey Heartland CCG. I don't know if it's a politically incorrect question or not. What's the linking that you've had with your local CAMS services in terms of their data, in terms of, you know, well-being and improvement in young people that both yourselves have been working with? You know, it just what sort of links, if any, you've been cross-making with them?
So, oh, Jo, did you want to answer to that one?
Yeah, I can do.
No, so I was just going to say, what I can say is that I know that we had most of our referrals, certainly for phase 1, all came predominantly through the CAMS teams, and so they were at the referral points. What we haven't been able to do, mainly because I think of time constraints for if you look at it as sort of 2 kind of 3-month projects really, which is what it was that we haven't been able to go back and identify the journey with them from their perspective of engagement, from referral onto the pilot through to you know, where they're at to date. But that is definitely something that we do on other projects that we're working on that are longer, and that's what my hope would be for the continuation of this project, and obviously other projects that we would do, is to be able to monitor that journey from their side of the fence as well. So everybody, we've got a quiet one.
Quiet, yeah, not used to this.
So I've got a question then. So with the verbal commitment to funding another year, is that something that could be built into the following year's project? Would it be, now you know you've got a year's funding, is it something that can be built into the work that from a service perspective? We know from a family perspective it's hugely impactful, but systems require to see it from there. So is that something that can be built in along with the cost benefit analysis that they're doing? I mean, imagine it's not easy, and sharing data on individuals is tricky, particularly around mental health services.
Yeah, so we know that we'll be looking at delivering the project for a further year. The question at the moment is to whether or not that could possibly be a further 2 years. So we hope to find that out over the coming few weeks. And obviously it would be wonderful if it could be a 2-year project, because the longer that you have on these projects, then the more evidence you can gather, and then the easier it is to be able to fund and continue this work. With regards to sort of embedding that relationship or having it embedded within a service potentially, again, that's something that we've done on other projects, is where we've had a position for an offer such as this to be embedded as part of you know, for example, a hospital setting or similar, and then we're able to monitor alongside the clinicians the impacts of our work. So that would be a great opportunity you know, to if that could take place.
I mean, one of the things that struck me when we were pulling this together was obviously one of the big announcements that they were talking about in the plenary about key working rolling out to every area. I'm still not sure what they mean by every area. I think they must mean ICS, but I don't know. Is that I was on a call with some trainee key workers, and clearly it's a really key role that requires a certain personality. But one thing that always struck me as a parent carer was, if you're key working, you're helping to coordinate and help them navigate through a system. And I think while the focus is on statutory services, being able to offer something that isn't a medical model, that isn't doesn't require this sort of statutory assessments and those kind of things, enables, from my point of view, I'm thinking, gosh, when my son was younger, it would have been amazing to be have a key worker, but have them to be able to come up with these, offer families these options as well, alongside the processes that they're required to go through, whether it's children's social care and everything else. So that's the thing that strikes me about this, as an adjunct or part of a an offer that, so because there's no how, it must be awful if you're a key worker and you're trying to coordinate across the system, and it's really tricky to be able to deliver something concrete for that family quite quickly. So that was just something that struck me. I don't know whether that's how practitioners see the future or not.
It would be quite difficult in terms of, for the key worker approach though, to be able to be as personalised a service as we have been delivering. So, you know, often the conversations to support the families would go on, you know, in the evenings via text messaging, because being on the phone for a phone consultation appointment was too tricky for the parent carer, you know, and that can be at the evenings or at weekends. I think that would be, you know, tricky to implement as part of the key worker role. And again, being able to you know, adapt and help them through those you know, things like the EHCPs, as well as being able to you know, get the IT equipment, for example, through the local authorities, as well as being able to you know, advise them directly, because of the level of training that the FSC has on positive behaviour support, you know, sleep management, all of those things, you know, that they'd, well, I hope that they have that many that high sort of qualified key workers. That would be brilliant.
I think what I was trying to say, not that it would be a substitute for the key worker role, but it would give the key worker another tool in his or her toolkit. And if you're waiting for assessments and everything's taking ages and the wheels are slow, even if he's trying to push it through, he or she is trying to push it through, to be able to say, while you're waiting, there is this community-based offer. It's not statutory, but do see what you can get out of it, and see if there's anything that can help you while we're trying to sort out the other more statutory. That was what I meant, not as a replacement, but as as a tool. I think they'll be would welcome something like this to help them, having things to key work, if you like.
It has been also commissioned by another local, by another CCG within our footprint, and it sits alongside their ND waitlist. So anyone on their neurodevelopmental pathway who's waiting gets this, like, part of this bespoke offer. So I know it has been commissioned to work alongside those kind of pathways. Got a very quiet room today.
If there aren't any other comments or questions, oh wait, Angie is typing. Let's see if that's a question.
Hello, should I just talk?
Yeah.
So I was just going to say, I'm down in East Sussex as a transition nurse specialist for neuro disability, and it would be really interesting to sort of chat to you afterwards, really, about how you managed to get that through within health and things, to get that offer, because we're looking at how we actually give get our wait lists down, because obviously they've rocketed up in COVID. So it'd be really good to sort of know what you've got around that and how that's working, really, because this is a great project, really good.
Thank you. My contact details are there on that slide, so feel free to be in touch.
Can I ask, will you, if we send you, if you've got the slides, are you able to forward this to the participants? Is that what the plan is?
Yes, we'll be sharing the slides and the recording in the next weeks or so. So they'll have that information. All right. Thank you so much, Joe, Ellie, and Amanda. It was a great presentation. We're going to ask the attendees one last thing to do. I'm going to post a link to our evaluation survey. This is just so we can report back to the DFE as they're funding these national events. So it'll just take 2 minutes of your time. And thank you for joining the national event and the workshops. I hope you enjoyed them all.
Thank you.
Thanks, everyone.
Thank you.
Bye-bye.
Thanks, bye.